I don't know if you guys can hear me.
Yes, we can hear you.
Thank you.
Yeah, we can hear you. You can continue.
All right, thank you very much. My name is Innocent. My name is Mr. David Innocent Chinecherum. I'm a prospective PhD student from Federal University of Technology, Owerri, in Nigeria, and I'll be your facilitator for today on inclusion and exclusion criteria in writing up a systematic review. And before I start, I would like to say something very, very important. I believe that by the end of this lecture, because I'm definitely going to share my screen, I have a slide for us. By the end of this lecture, it's expected that we will be very, very crazy about inclusion and exclusion criteria. I feel like it's something even you looking at your friend or your, whatever friendship you engage in, you would always want to also apply the same system, inclusion and exclusion criteria I'm going to teach you today in other things in life. So yeah, that is how entertaining I'm hoping the class is going to be. And also, I'm also going to share some of the learning outcomes that I expect us to understand. But then at the end of today, it's expected that we will know what, I'm just going to brush us up on what systematic review means. Then I'm also going to talk about the inclusion and exclusion criteria. What's inclusion criteria? What is exclusion criteria? Also, I'm also going to talk about, I'm going to give some models that we use in formulating our inclusion and exclusion criteria for you to have a research problem or for you to do a systematic review. It's very, very important that you have, a clear model that you use in formulating your inclusion and exclusion criteria. I'm also going to make us understand other considerations that we need to consider that might not be in the model for you to formulate your inclusion and exclusion criteria. Thank you very much. So I'm going to share my screen right now. Yeah, can you see my screen?
Yes, please, we can see your screen.
We can see very well.
All right,
yes,
thank you.
Can see you.
Thank you very much. So that's my name, David Innocent. So at the end of this class, please, I don't know, you can post on the chat box if you have any question. I will definitely address them. Now, this is our outline for today. Just like I said, I want it to be a participatory class. We need to know what is a systematic review. For you to talk about inclusion and exclusion criteria, you need to know what a systematic review is, right? Good. Then we will now talk about the hierarchy of evidence and research. Where is the systematic review placed on the hierarchy of evidence and research? Then after that, I'm not going to talk about the inclusion and exclusion criteria for a systematic review. Then after talking about the inclusion and exclusion criteria for systematic review, we'll talk about the rationale. Why should we have an inclusion and exclusion criteria in a systematic review? Why can't we just start writing up a review? Why is it compulsory? Why is it imperative for us to have an inclusion and exclusion criteria in a systematic review? Then I'm now going to talk about the models or the frameworks that are used in formulating an inclusion and exclusion criteria for a systematic review. Then I'll also talk about the examples of the models and frameworks that are used in formulating inclusion and exclusion criteria in either a qualitative or a quantitative systematic review. So we need to understand the appropriate model for which, when you have a research question or when you have a research problem, you need to know the exact model that you use in formulating your inclusion and exclusion criteria. Then also, we will need to also look at other considerations that we need, that is very important for your inclusion and exclusion criteria. And then I'll also conclude and give us a take-home meal. Is that correct? Good. So yeah, we will need that. We'll definitely need to have a take-home meal that we'll use to work in. So what's a systematic review? Now, you and I know that when we have a systematic review is a type of research that follows a structured methodology. Why it is called a systematic review is because of what? The word systematic means that what? It follows a structured methodology. There is a particular system that you use, that we will have to adopt for us to answer any research question. You understand? So meaning that, let's say tomorrow you want to publish a research paper, or you want to write a systematic review dissertation. What the markers or what the reviewers are after is, have you followed that particular system in answering the research question? Now, if you've not followed that particular system, then it means that it is not a systematic review. Now, it is possible for us to have a narrative review. Now, in the aspect of a narrative review or a normal traditional literature review, you can just follow any subjective process in answering your research questions. Now, that is that. Now moving ahead. Now,
hello, Mr. David.
Okay.
Kindly, can you put your slides into slideshow?
Okay.
Slideshow, please.
All right. Okay, I'll do that.
The bottom on your right. The bottom to the right. The bottom to the
right. All right. So all right. So as I was saying, now I was talking about a systematic review, right? So it means that for you to write a systematic review, you need to have what? A structured methodology. There needs to be a process, that you need to follow. That is why, while you are, as an early career researcher or as someone that is researching, systematic reviews are given more priority because you have followed a particular established methodology. But if you want to just write a normal traditional literature review, the journal or the reviewer or whoever you're writing to might be like, how much have you spent in this field to generate some of these themes or to write on these particular areas? So what the systematic review tries to do is that it follows a more rigorous and comprehensive process to appraise any evidence. So that is it. And also, you need to understand that for you to conduct a systematic review, it is very important that when you have identified a clear research question, then what do you do next? You now need to do what? State to the reviewer which particular checklist or template that you will be adopting to report your appraisal. So in a nutshell, that if we talk about a systematic review, a systematic review, it's aimed to ensure that there is a comprehensive and unbiased, reporting of evidence. Now, this is the hierarchy of evidence, in research. Now, you might say, why didn't I just come out to talk about an inclusion and exclusion criteria without talking about a systematic review? We need to understand that a systematic review is at the top, or is at the height, or is at the highest top of, of evidence in research. Now, particularly for those of you that happens to be in medical sciences, for you to ascertain the effectiveness of any therapy, or for you to ascertain the clinical justification of any particular action, it must be backed up by evidence from a systematic review. Meaning, what is systematic review in this particular facet is that we have now reviewed primary studies, what has been done beneath now, and we have now combined of this, now give an overall estimation that this is what that's applicable, in this particular field. That is the essence of what is systematic review. So for systematic reviews helps policymakers in making decisions. For you to say that paracetamol is effective for reducing symptoms of headache, it means that what we have appraised RCTs, or we have appraised cohort studies, or we've appraised case control studies, or we've appraised case reports that are trying to evaluate paracetamol for reduction of symptoms of headache. That is why systematic reviews are at the top of the evidence. So for any decision at any clinical setting, now listen, take this, you can take this down. For any decision at any clinical setting, a systematic review evidence is very, very important, because why we must have a systematic review evidence is that what this has been ascertained from already, it has been ascertained from what? From a combination of studies that has been what summarized. So we can now generalize and say that it can be stated that what metformin can be used in managing what diabetes, right? Or we can say that what so and so therapy, cognitive behavioral therapy, is effective for managing what severe depression, because of what we have summarized RCTs or cohort studies or case control studies that are Binet systematic reviews that will need to be summarized for us to say that what, for us to come in agreement of any clinical decision. So systematic reviews are at the top of the hierarchy of evidence. So the meaning that was for you to conduct any systematic review, you must come up with what? A very, very reproducible methodology, a methodology that your reviewer or whoever that wants to go through what you've done, such and such a person can go through it and arrive at the same results that you've done. That is what differentiates a systematic review from a normal traditional literature review or a normal traditional primary research. When you've done a systematic review, it means that when another person follows that same process that you've already followed, the person will still arrive at the same result. And that is why inclusion and exclusion criteria is is an essential, in short, is one of the most essential components for a systematic review. Any systematic review that doesn't clearly state its inclusion and exclusion criteria might be prone to bias. Now, here is where the class starts now. Now, we need to know what is an inclusion and exclusion criteria. Now, you look at this picture here, we have people, we have individuals, some of them are colored red, some of them are colored blue. Now, let's say everybody here happen to be suffering from diabetes, or happen to be suffering from, one health problem or the other. Now, for you to conduct a systematic review on studies that have evaluated people who are, who are suffering from diabetes. Now, this is a clear picture now. It means that what? That everybody here are all individuals, but there are some people that will meet up to the criteria of the type of studies you want. So those are the ones that are marked blue. Why the ones that are marked red are the ones that will be in your exclusion criteria, although they happen to be humans, but they won't be eligible for selection. So by that, we can define that these criteria are used to define the characteristics of what? Of the participants in the what? In the study. So that means that for you to carry out a research, a systematic review research, there's some certain characteristics that the participants will have that would lead you to do what? To excluding them from the what? From the synthesis. Is that clear? So now we are going to now understand the rationale, the reason for a what? For inclusion and exclusion criteria in research. Just like I've already explained previously, when the rationale for inclusion and exclusion criteria in a systematic review is to ensure that the review is focused on answering a well-defined research question, and that the studies included in the review are relevant, valid, and reliable. So I'm going to also demonstrate examples of where we have where I have formulated a research question and I have used the appropriate inclusion and exclusion terms to do what? To differentiate the studies. So the major reason why, or the rationale behind us formulating an inclusion and exclusion criteria for every systematic review is that we show that these particular studies are actually relevant and reliable to the particular research question of focus that we are actually looking at. So it doesn't matter the type of research you are doing or your supervisor has asked you to embark on. It is important that for you to ascertain the quality of the evidence that your research is providing, you must provide the reviewers or your supervisor or the markers with a clear inclusion and exclusion criteria. So it is very, very, very paramount for your research. Now, we just talked about inclusion and exclusion criteria. Now, we need to now know what inclusion criteria means before we go into examples. Now, for inclusion criteria now are those specific characteristics that those participants must have to be eligible for the study. If you look at the last pictorial representation that I gave now, so those participants must be in blue color. So meaning that this you will have a lot of characteristics that we might use to state our inclusion criteria. It might be their age, it might be their gender, it might be based on their medical history. Depending on the topic, it might be based on specific symptoms or conditions. You know, these are the things that can actually inform our decision making when we are writing the inclusion and exclusion criteria. So for example, now I just gave here that in a clinical trial of a new drug for diabetes, the inclusion criteria might specify that the participants must have a diagnosis of type 2 diabetes and be between the ages of 18 and 65. So this is the inclusion criteria. Now, if we say that the inclusion criteria is for participants with type 2 diabetes, we are wrong, because there might be some of them that are above the age of 65. But for us to be distinct about our inclusion criteria, those participants must be between the ages of 18 and 65, and they must also be diagnosed of type 2 diabetes. So that is what that would inform our inclusion criteria as a definition. Whereas for our exclusion criteria, you know, it could be possible that those participants have, they have diabetes, type 2 diabetes, and they are within the age of 18 to 65. But it's possible that we can say, okay, participants that have type 2 diabetes between the ages of 18 to 65 who are HIV positives will be included. So meaning that inside, considering the characteristics of our inclusion criteria, we can still provide further factors that we might use to distinguish other participants. So that is what our exclusion criteria is going to look at. So now, but if you look at this example here we said, for example, in a clinical trial of a new drug for hypertension, the exclusion criteria might specify that participants with a history of heart disease or kidney disease would be excluded. So in the inclusion criteria now for this topic, it's possible that we might have stated participants, who are hypertensive. Now, for us to exclude now, irrespective of those participants having hypertension, it's still possible for us to still go down further to exclude people who have heart diseases or kidney disease. And now I'm going to say something. The essence of exclusion criteria is to minimize bias in the study, because for any research that your supervisor or your marker or your reviewer, maybe you submitted an article for the publication, for any article or any particular study that you're trying to carry out, it is possible that there are some participants or there's some individuals or there are some characteristics of those population that might actually meet your inclusion criteria, but it's possible that given to the other attributions that those participants have, it might actually bring bias to the study. So it's possible that participants now who have heart disease also might also impede or bring bias into the findings. So for you to improve the quality of the evidence, it is very, very paramount that you make clear that these are the exclusion criteria. Any study that is going to report participants with heart disease, while I'm including people with hypertension, I'm going to do exclude it from my synthesis. All right. Now, before we show clear-cut examples on formulating our inclusion and exclusion criteria, if you can remember, when I started this class, I told you that for you to identify a health problem, let's say currently maybe you're in the UK or you're in the United Kingdom, and there is, it happens to be that people who are migrating into the United Kingdom are having, severe depression, maybe reasons which you don't know. Now you might come up with a topic because there are several problems that can lead to topic identification. Now you might come up with a problem that what are the problems or what are the measures that might be used in combating maybe severe depression among participants, or maybe what are the available measures or treatment therapies for combating severe depression among migrants. Now, you don't just stop there. Now, it is very, very important that you know that for you to formulate your inclusion and exclusion criteria, there must be a model that will inform your what? Your tabularization of the characteristics of the studies. Maybe you want to present your inclusion and exclusion criteria in a tabular formula, now in a tabular format. Now, you need a model, and each of these models must go in line with the type of study. So meaning that what from here you could see that there are several models and frameworks that can be used to formulate the inclusion criteria or exclusion criteria of a systematic review. And these models are dependent on the research question. Now, the model that we will use for a quantitative systematic review, now note down, the model that will be used for a quantitative systematic review might differ from the model that we use in formulating the inclusion and exclusion criteria for a qualitative systematic review. This is one problem we have with some of PhD students. You see PhD students, writing a systematic review dissertation, and it happens to be a very quantitative systematic review. And on the position, on the paradigm, they've already stated that they are going to use a positivist approach. Positivist, that is using a deductive approach as their form of reasoning now to formulate their inclusion and exclusion criteria. Now you see them using the wrong model for their inclusion and exclusion criteria. You see that when you send this, when you use the wrong model for your inclusion and exclusion criteria, it might predispose your reviewers or markers to, it might actually bring in bias to the study, because the wrong model will not show the appropriate components for the study. Now we are going to bring perfection now into what I've said now. We're going to look at examples. Now, but before I talk about examples now, I need to explain each and every one of the models that are used in contemporary systematic reviews. That's the modern systematic reviews that we do now. Some of the frequent models that we use in formulating our inclusion and exclusion criteria. Because for you to state to the markers, this is your inclusion, this is your participant, this is the inclusion criteria characteristics, and this is the exclusion criteria, you must underpin it with a model. Now we have the first model here, which is the PICO model. Now the PICO model is usually used for quantitative research, quantitative systematic reviews. And you can agree with me that a quantitative systematic review is a systematic review that tries to examine, it possesses, it tries to examine more of numeric attributes about a particular review. You're trying to answer a research question on how much, how many, you're trying to establish the degree of, a particular numeric characteristics in a population. Whereas in a qualitative systematic review, you are trying to explore information on opinions, experiences, of maybe study participant, or depending on the context of your research topic, you're trying to understand research questions on how, why. You get you get to understand that a research question that is being answered in terms of how much, how many, is leading to a quantitative result, right? Now, why for a research question that tries to understand why, experiences, opinions, how, it's leading to a qualitative. And now it's still possible for you to have a mixed method systematic review. And now in that particular aspect, now you still need to use the appropriate model. Now, for the sake of this lecture now, and also sorry.
Yeah, around.
All right. So for the sake of this lecture, we have the PICO. Now, the PICO is known as population intervention comparison and outcome. So depending on the nature of your research question, you have to look at the PICO. You take out the characteristics and formulate your inclusion and exclusion criteria. We're going to show that further in an example. We also have the PICOs, population intervention, comparator, and outcome study design. Now, when you want to attach study design to it, now we also have the SPIDER framework, the sample, phenomenon of interest, design, evaluation, and research type, which stands for the R. We also have systematic reviews where we use the PEO model to formulate our inclusion and exclusion criteria, and is usually used for observational studies, cohort studies, and case control studies. Remember, I said for the PICO is mostly for quantitative studies and all that. So we're actually going to show further examples to justify that. Now, we also have other models like the SPICE. SPICE now is the setting, perspective, intervention, comparison, evaluation. So it's usually used for economic evaluations, research, depending on the context. We also have what we call scoping reviews, scoping reviews of low relevance, not compared to the systematic review, the PCC framework, population concept, and the context. Now, we also have what we call the PICOT, where we have the population intervention comparison outcome and time frame. So we also have the model we call the ECLIPSE framework for formulating our inclusion and exclusion criteria. So it's usually used for studies evaluating the safety of the effectiveness of drugs or medical devices. So what we need to understand is that these models that I've all listed here must be applied in your inclusion and exclusion criteria for a systematic review. For a systematic review to have high relevance, you must apply any of these models that I've listed here. Now, this is an example considering the topic, considering the webinar that we are currently conducting. Now, for a quantitative study, trying to understand, now in this study, we're trying to use the PICO model now to formulate our inclusion and exclusion criteria. And now the research question that we are faced here with is we're trying to understand hypertension. We're trying to understand new medications that are used for hypertension, the effectiveness of new medications for hypertension among adults. Now, this is our inclusion and exclusion criteria. Now, formulating your inclusion and exclusion criteria at some point must come with a subjective process. But for every subjectivism, what I mean by subjectivism now is maybe from your own rationale, you're trying to justify why you need to exclude this. For any particular item, for any item that you put in your exclusion criteria, you must justify it. You must justify it in your text. So let's say for this particular review, we're trying to, the broad research question here now is, what is the effectiveness of new medications for hypertension among adults? That's compared with other existing medications among adults who are age 18 or older. Now this is the inclusion criteria. Now we need to include studies that are reporting adults that are aged 18 years or older, right? Diagnosed with hypertension. Now, in our exclusion criteria, now we don't just want to involve all adults now that are aged 18 years or older diagnosed with hypertension. Now, I want to exclude patients or adults now who have severe or unstable hypertension. So this can form for our exclusion criteria, right? Good. Now, for our intervention, we want to look at new medications only. Now, for the exclusion now, we're excluding patients with history of drug allergy to any of the components of the new medication, right? So this is the essence of the items here is to do or to make sure that we formulate a very clear-cut, exclusion criteria that will not impede or bring in bias to our review process. Now, also for the comparison, we are looking at studies that are comparing new medication for hypertension with placebo or existing medications. So that is what we're after. Now we're now going to exclude studies that are focused on pregnant or patients who are pregnant or breastfeeding. Now that is also going to fall for our exclusion criteria now in terms of our comparison. And now, for our outcomes, the major outcome that we are looking at is for participants who have been tried for new medication and the effectiveness of new medication with placebo or existing medication among these adults, where the only outcome of interest is what? Reduction in blood pressure. So meaning that if we have other outcomes, maybe such as patients with history of significant cardiovascular diseases, such as this and that, we are not interested in them. So meaning that Now, for us, now remember, what makes your review, what improves the quality of evidence in your systematic review is that you have followed the inclusion criteria properly and you have excluded studies that does not fall in your exclusion criteria. So meaning that during maybe in your next class on search strategy and study screening, it means that you will need to formulate your search strategy based on your inclusion criteria. Your inclusion criteria is going to play a very, very massive role in formulating your search strategy. So if we are going to have a search strategy class or session, you will not need to see that for you to have studies that will relate to your inclusion criteria, it means that you do what? You need to refine your search strategy appropriately using your inclusion criteria. And during your study selection, remember, for a systematic review to be conducted, it means that you need to do what? Search for studies and select studies based on a criteria. And that criteria is your inclusion criteria. And now when you have now selected those studies, you now use your inclusion criteria to select them and now appraise those studies based on your inclusion criteria. So that is the explanation. So it means that what? That considering your inclusion criteria now, that's going to form a very, very massive, it's going to play a very massive role in your what? In your study selection and other things and other items that will be in your checklist for what? Conducting your systematic what? Review. Now, before I also give other examples, now these are research questions. These are a couple of research questions, and it will be very, very important for you to also do some tests, test yourself based on this, some of these examples that I've just shown here before I show another model of how to identify your population, your intervention, your comparison group, and your outcome. Now, it is now from your identification of this population, of the population here, your intervention, your comparison, and your outcome that you can now define in details those that will form in your inclusion or those that will form in your what? In your exclusion. Now, I also want to say before I continue that you need to remember that before you write your systematic review of literature on a particular public health research question or any particular research question, maybe in social sciences, you must state the item that you are to adopt. Now, there's something we call the PRISMA reporting items and checklists. And when you look at the PRISMA reporting items, you find out that there is always a section where where you've got to report your inclusion and exclusion criteria. I'm also going to show the checklist towards at the end of the class, the PRISMA checklist that is used for systematic reviews and meta-analysis. That's why it's called the PRISMA. The meaning of PRISMA means preferred reporting items for systematic reviews and meta-analysis. So the essence in your checklist, it means that your reviewer or your supervisor or your marker is after, have you followed the checklist? And if the checklist, is not, if the checklist is not followed, it means that what? If the checklist has not been followed, it means that what? That you have not provided the, remember, it is called what? A methodological process. You've not provided the methodological process. So please, let's try and mute our mic so that there won't be confusion. Now looking at this first research question here, we have, is ibuprofen more effective than paracetamol in relieving fever in children? Now, if we want to do a systematic review on this research question now, we are asking now, what is our population of interest? What is our inclusion criteria for this population? Are we looking at all children? Are we going to exclude children that have HIV? Are they going to bring in bias in terms of relieving, in terms of our outcome? Now, what is our intervention? Our intervention is ibuprofen, meaning that for here, studies that are not addressing ibuprofen as the intervention will be excluded. And I'm sure that this is going to be very simple to us to understand. Now, for our comparison using PICO, are we comparing from the title here, ibuprofen with what paracetamol, meaning studies that are comparing with placebo, studies that are comparing with any other type of therapy that is not paracetamol will be excluded. Now, our outcome of interest in our inclusion criteria is going to be what? Reduction of fever. Any other outcome that is not, that the studies are reporting that is not reduction of fever are going to be in our what? In our exclusion criteria. Now, for this second study, do multi or single courses of antenatal care corticosteroid therapy reduce complications among singleton pregnancy? Now, our population here are participants who are undergoing what? Preterm labor. Now, participants that are not justifying a preterm labor are going to be excluded. Now, our intervention of interest is what? Repeated corticosteroid injection. Now, any particular type of intervention, or maybe in our intervention, maybe we are more about intervention that started from 6 weeks. Any type of intervention that is less than 6 weeks, but it is still repeated corticosteroid injection, can be what? Will be excluded. So now we need to understand something, that when you are formulating your inclusion and exclusion criteria, there are some characteristics of your inclusion criteria that would make you adopt your exclusion criteria. So meaning that if we are talking about, let's say for this study now, first study that I just explained now, we're talking about children, right? So meaning that we will consider children, but in our exclusion criteria, we're not just going to say adults. No, we can say children that are suffering from maybe diabetes. I seen it. We still have children in our exclusion criteria, but for you to say adults, already when you say children as a population, it means that every other thing, adults are not even in place. Now, what are the characteristics of children that you don't want to consider in your study? So you make it clear. Now, if you consider ibuprofen, now what are the characteristics of this particular therapy or this drug? Maybe is it in terms of the number of duration you exclude it? Maybe people that took ibuprofen twice, or that took it intermittently, or ibuprofen, or studies that are addressing ibuprofen with another therapy too, that are combining ibuprofen with another therapy, you're going to do what? Exclude those studies. You just want studies that are single at what? Ibuprofen. Now, in terms of your comparison too, there could still be some characteristics of this particular therapy or this drug that would lead to your exclusion. So not necessarily are you going to say studies that are maybe a placebo, maybe not paracetamol will be excluded. It's possible that it maybe the number of times, or maybe where paracetamol has been used to compare, or maybe there's a particular characteristics among paracetamol that you wish to exclude. That can inform your what? Your exclusion criteria. And also the same thing applies for our outcomes. So we keep going. These are also research problems and questions. And this is how we can use the PICO model to formulate the inclusion and exclusion criteria. So I would share the slide with us, along the line too, so that we can also take more critical look at it. So, all right, so let me move on. Now, here is another example of another model. Remember here, we talked about several models that we can use in formulating our inclusion criteria. We talked about the PICO spider. Right now, and we're going to look at an example of where spider has been used to formulate your research question. Now, this is an example. Now listen, for PICO is used mostly for quantitative studies, quantity. While spider is used mostly for what? Qualitative studies. Studies that have what? Qualitative studies. And now you can remember when I told you about experience being on the phenomenon of interest. Now, the research question here now is this. What are the experiences of cancer patients adult patients now? Adult cancer patients undergoing what? Undergoing chemotherapy treatment. Now, this is the what? The research question. And when you've now got the research question, you will now do what? You will now break down the inclusion and exclusion criteria. I have already brought out some questions, some examples, also further examples where we can also do some practice tests try to look at some, we look at some questions, and from those questions, we also formulate our own inclusion and exclusion criteria using the appropriate model. Now looking at this example here, we're trying to understand the experience of cancer patients, adult cancer patients who are currently undergoing chemotherapy. Now, what is our sample? Our sample are what? Our sample can also be known as our population or our participants. So when a research question is being given to you, you need to know you need to clearly outline what your sample is, particularly for any systematic review.
Okay,
so our sample here are what?
Mr. Sunday to provide that update on for this one. I think it's on the call.
Okay, so our sample here are what? Adult cancer patients. So now adult cancer patients aged 18 or older currently undergoing chemotherapy treatments. Now for the exclusion criteria, now we have cancer patients who have not undergone chemotherapy. Now for the phenomenon of interest, we have experiences of cancer patients. Now for our exclusion criteria, we have patients who have not received chemotherapy. Now listen, for our exclusion criteria also, we can also, this is an example, like I said, this is an example. We can also have other items to include in our exclusion criteria, so that you will not say, okay, are these just the items to exclude? No, these are not just. You can also put in maybe studies that are reporting prevalence. You're not interested in them as your phenomenon of interest, or studies that are reporting maybe maybe that are trying to combine experience with other maybe certain characteristics that are not of interest to you. Like I said, formulating your inclusion and exclusion criteria can follow a subjective process, but must be justified. So meaning that whatever item you have put in, maybe as a result of you looking at previous studies, you must justify in your text why you have excluded such and such study. Now, like I said, for our design, the D in SPI that represents our design, it represents the type of study. So qualitative studies using interview or focus groups will be our inclusion criteria. So studies with quantitative or mixed method studies will be excluded. Now for our evaluation, another name for evaluation is outcomes. So we are interested in patients' subjective experience, perception of chemotherapy treatment, including physical and emotional effects, coping mechanisms, interactions with healthcare workers. So these are that forms our evaluation or outcome. So another name for evaluation, another synonym for evaluation in this context is our outcome. So studies that primarily focus on clinical outcomes or objective measures of treatment response will be excluded. Now for the research type here, for the research type as our R, we are considering primary qualitative research studies. So meaning that anything such of review articles, case reports, editorials will not be part of our systematic review. It is going to be excluded. So it is possible that you might find a study that might be reporting patient subjective experience and perception as a review article. So it means that you're going to throw it out in your during your study screening. Now, remember, I talked about examples. I've given an example of PICOs. The difference between PICO and PICOs is that in PICOs we have study design added. So you can decide to, at the later end of this lecture, we'll also see further examples where we added study designs. Study design can also form part of your considerations in your inclusion and exclusion criteria. You can say you're only interested in cross-sectional studies, you're only interested in cohort studies, you're only interested in case control studies, case reports, case series, as the case might be. You're not interested in studies with qualitative design like phenomenological studies, grounded theory studies, and all that. So that is just the difference between PICO and PICOs. So you need to also add your study design as part of your table. And I will also show examples of other reasons of what we should add. And also, we also have another framework because of our time, we also have another framework known as the PEO. So here now we are looking at the population. Population might be participants who have, maybe depending on the nature of our research question, participants who have HIV and AIDS. Maybe we're trying to look at maybe exposure to occupational health infections among nurses. Then our population of interest might be nurses. Our exposure of interest is what? Occupational health hazards, and our outcomes are what? Maybe HIV and AIDS, other ailments that can arise from occupational hazard exposure. Then that is it, and you see that your inclusion and exclusion criteria has already been formulated. So the basic thing you need to know in your inclusion and exclusion criteria is you need to clearly identify the suitable model for the topic, and also use that particular model to do what? To develop your inclusion and exclusion criteria. Now, so basically, some of the things that I've actually talked about here are also synonymous with this, So, but now we're going to look at this PCC for scoping reviews. We're also going to look at that example as well as other examples where it has been applied. I went back so that we would be sure that we are still very familiar with all the models that I've listed out here. Now, this is now let's assume. Excuse me, please. I want to drink water. Now, let's assume we want to. Now, sorry. Now, let's assume we want to do a scoping review. Now, an inclusion and exclusion criteria is also very, very paramount for a scoping review. Now, for a scoping review, we have a model that is appropriate for formulating our inclusion and exclusion criteria, and that is what we know as the PCC framework. So you see some PhD students or some PhD students who are writing for their dissertation, they use PICO to formulate their scoping review. And you look at the nature of the research question, and even the research being a scoping review, and you see them using the wrong framework. And you see that you begin to understand that when you use the wrong framework for the scoping review or for the systematic review, you might not really identify all the necessary compartments because you are using the wrong model. So it's very, very appropriate for you to, while formulating your scoping review or your systematic review, you need to use the appropriate model for it. Now, in this context now, we have the criteria now for our inclusion and exclusion criteria now is, maybe we have a research question on exercise interventions among adults diagnosed with fibromyalgia. Now, for this particular health disorder now, for you to conduct a scoping review, remember, a scoping review is explained to be, a form of literature review where you try to map all available evidence. So when you're writing a scoping review, you're just trying to map all the available evidence. There is no quality assessment for a scoping review because you want to know what literature is available for this particular concept or item that we are focused on answering. So that is that's going to inform your scoping review, your scoping review model. Now here, if for scoping review for the participants or the population, we're interested in what adults diagnosed with this particular fibromyalgia. Now, for pediatric patients or patients with other chronic pain conditions, they are going to be excluded. Like I've taught us now again and again. When you have your inclusion criteria, there's some characteristics of your inclusion criteria that will form in your exclusion criteria. So you remove them. So like I said, this is an example. So it is possible that while you're conducting your systematic review, you also understand the reason, or your supervisor tells you, I need you to do this, or I will advise you to put this into exclusion. I also advise you to, to remove undesirable characteristics from your participants. So it is also possible for you to do what? To give your to obey sort and sort of change that the person asks you to do. Now, for the concept, we are looking at all the traditional or available literature that are addressing exercise interventions to manage what? Symptoms of fibromyalgia, including aerobic exercise, strength training, or mind-body practices such as yoga or Tai Chi. Now, for exclusion criteria, looking at what pharmacological, we are not interested in pharmacological interventions or non-exercise-based interventions, such as what? Cognitive behavioral therapy. So meaning, when you formulated your inclusion criteria and your exclusion criteria, once you find studies that are addressing pharmacological intervention or non-exercise-based interventions, you do what? You put them into what? Exclusion. Remember, what makes your systematic review very qualitative is because of what? Is because you have adhered strictly to the what? To the inclusion and exclusion criteria. You don't just start a systematic review and along the line, you go off of what you have already clearly stated to be in your what? In your inclusion and exclusion criteria. That will bring in what? Bias in your reporting process. And now, for our context, sometimes we can use our context as studies conducted in the USA, studies conducted in Malawi, studies conducted in Ghana, studies conducted in Germany or in Europe, in sub-Saharan Africa, and all that. But because of the nature of this study, we can decide to say what? We are opening to what studies conducted in any setting. Now, it also includes what? Inpatient or outpatient rehabilitation program, community centers, or home-based what? Programs. So here now we are excluding studies conducted exclusively in workplace or what? Study setting. So, or school settings. Now, remember, for your inclusion criteria and your exclusion criteria, you usually apply them during your study screening. Immediately you are done doing your search. Once you want to start your title and abstract screening, you do what? You first of all look at all the titles that are not related to your what? Inclusion criteria, or that are reporting your exclusion criteria. You exclude them. Now, if there are titles that are related to your what? To any of the terms related here, you now do what we call the full text screening, and also be sure that components of your exclusion criteria are not reported in those primary articles. You have over, imagine as a researcher or as a PhD student, you have about 100 or 500 papers to review. Now, what do? When you formulated your inclusion and exclusion criteria on this particular, or you want to do a scoping review on this, now you're looking at your 500 papers. Now you see studies that are talking about patients with chronic pain, you remove, exclude. You state your reason for exclusion, wrong participants. You see studies that are talking about pharmacological intervention, you exclude. You state your reason, wrong concept or wrong phenomena. You see studies that are talking about work-based or school settings, you exclude based on what? You have defined your study setting as studies that are conducted in what? Inpatient or outpatient rehabilitation program centers, community centers, or home-based program centers as well. So that is how you do what? You formulate your what? Your inclusion and exclusion criteria, particularly for scoping reviews. Now, like I said also, while you're conducting your systematic review, it's possible that it is not just the frameworks that we've listed here, such as PICO, this, that, population intervention comparator outcome study design, sample, phenomenon of interest, design, evaluation, and research type, and all these other things, right? There are still some other considerations that we need to do to consider for our inclusion and exclusion criteria. It is not enough for us to only exclude based on participants, because your supervisor might tell you, yes, you've included this, you've included all the studies that are required to meet your learning outcome for this systematic review. But why are you including studies that are published in 2001? There could be more recent updates. So meaning you also need to consider your publication date, right? In your inclusion and exclusion criteria. So while you're including studies, you must consider the date of the publication. You might say, oh yeah, I don't want studies that are published. I want studies that are published only in 2022, that they will be in my inclusion criteria. Or studies that are published later than 20, or studies that are published in 2022, but in January to February will be excluded. Or I'm interested in studies that are published from 2000 to 2020 or 2023. Or I'm interested in studies that are published from a particular duration, only studies that are published during the pandemic from 2019 to 2022. I'm not interested in studies that are published in 2022. So that can also form part of the consideration in your inclusion and exclusion criteria. And now also, like I said, some of the models that you will need might require you to state the study setting. Maybe you're interested in only studies that are published, beginning to the nature of the topic. You're interested in studies that are published only in sub-Saharan Africa. You're interested in studies that are published only in Nigeria. You're interested in studies that are published only in Europe. You're interested in studies that are published only in North America. Or you're interested in, you don't have any restriction on study setting. Then you also have to do what? State it in your inclusion and exclusion criteria, right? So also, you can also consider the publication status. Are you interested in studies that are you interested in preprints? I mean, what do I mean by preprint? Studies that are still currently that are still awaiting publication. So it's possible that like I'm going to share a publication, a systematic review publication that we published. That was in that was last year, 2022. And in that systematic review publication, we tried to compare metformin with glyburide. We tried to do a meta-analysis, but we realized that that was that was a study on remdesivir, because I'm actually trying to understand the particular study. It was a study on remdesivir, effectiveness of remdesivir among pregnant women who are suffering from COVID-19. Now, in that type of study now, we realized that there were not really so much original, published articles that has already been published. So we saw ongoing trials that were published as preprints, and we also saw studies that has not really been published already on Research Square. So what did we do? We needed to do to include them in our as part of our study selection. So it means that in our inclusion criteria for the study now, we would say yes, preprints are going to be allowed, be given to the nature of the availability of studies. And it's also possible that we want to, because of the quality of evidence for a particular study, we can have what we call a living systematic review. A living systematic review is a systematic review that is still undergoing continual updates, right? So that is a living systematic review. So for a living systematic review, you see that a living systematic review might include preprints. So that will also form as part of the considerations for our inclusion and exclusion criteria. Now, another criteria that we can also consider in our publication, in our systematic review publication or dissertation, is the type of publication. Now, it's possible that not all models. What I mean by models, now, if you look at this model, you see that it doesn't talk about publication status. It only tells us PICO, about the participants. But you need to tell us about the duration, study duration time. You need to also tell us about the study setting, where it's going to be conducted. You need to also tell us the publication status, type of publication that you're interested in. Now, it is not shown in all these models, in some of these models. So it means that it needs to be an addition to your systematic review, inclusion and exclusion criteria. Now, the essence of showing us that is that we can say for a PICO, for a systematic review that is trying to understand the effectiveness of exercise in managing cardiovascular disorder, effectiveness of exercise for managing cardiovascular disorder. Now, we might state it clearly that we're not interested in opinion articles, right? We're not interested in case studies. We're not interested in observational studies. We are not interested in editorials. We're not interested in commentaries, because sometimes we can decide to publish commentaries. So are we going to do a systematic review with a commentary? what type of systematic review is that going to be? If it's in a scoping review, it can be applicable because you're just trying to map available literature. But for systematic review of, higher quality evidence, are you going to use a commentary? Are you going to use a short communication? So if you are going to justify why you're going to use it, then you can also include it in your inclusion and exclusion criteria, so that during your study selection, you can also state clearly that you are excluding opinions, you're excluding case studies, you're excluding observation, or you are going to include this, or you're going to exclude that. So these are other considerations we must have to put in place for our systematic review inclusion and exclusion criteria. Now, another criteria that we must have to consider is our language status. It is not in the PICO model. Language status is not there, but it's very important for your inclusion and exclusion criteria in your systematic review. Because if you have not told us the type of studies that you're going to include, there might be missed studies. Now, sometimes we can do a search and we use Google Translator to translate studies that are published in other languages. Like now, we are conversing all in English. Now, it's possible that, let me assume that everybody who is attending this webinar is a potential study for a systematic review, that you all here are articles, about 500 of you, or I don't know how many you guys are. Everybody attending this webinar is a study, is a potential primary study that I want to use to do a systematic review. Now, if I state my inclusion and exclusion criteria and I include everybody here, it is possible that I might have missed out on studies that are on people who listen to French alone. I don't know if there's anybody here that's attending from Ivory Coast. So if you're attending from Ivory Coast, and you only speak French, or you're attending from France and you only speak French, so you mean that it's possible that I'll miss out on those studies. So in your inclusion and exclusion criteria, if you're going to focus only on studies published in English, you must do what? You must itemize, you must write it down and tell your researcher or your review or the reviewer or the marker who is interested in that you are concentrating solely on studies published in what? In French, right? Or you're concentrating solely on studies published in English, or you're going to include all studies and you're going to use a Google Translator to do what? To translate your studies. So I am very sure that we've really enjoyed this very short educative session, because because the nature of this class is specifically on inclusion and exclusion criteria. I was going to tell us that there are still many more decisions that can follow after your research due to the inclusion and exclusion criteria that you've adopted. If you've included preference, or if you have an ongoing review and you've included case studies published in English, studies published in South Africa, or studies published in North Africa, or studies published in China and all that, it is very, very important that you do what? It's very, very important that you do what? You clearly outline it in your inclusion criteria. Now, the next part of this lecture is on we're going to now conclude by saying that that the inclusion and exclusion criteria are actually essential components of every systematic review, just like as I've said. So without a clear inclusion and exclusion criteria, it's possible that you are missing out from providing an evidence-based research. And there are so many different models, but because of the timing of this class, I wanted to explain PO, SPICE, and all that. But I'm sure from our understanding of how to apply the SPIDER, PCC, PO, we can also use the same format, in applying it to all these other studies. So what you just basically need here is to tell us the population from your research question, your intervention, the comparison, the outcome of interest, and the time frame. You're only interested in studies published in 2001, 2012. That is it. You state it. In your exclusion criteria, you also state what you are not interested in your inclusion criteria. So here are take home meals. Now these are topics that I want us to practice. I will need us to understand I will need us to identify what is the appropriate model for this research question or for this topic on experiences of nurses towards workplace violence in sub-Saharan Africa. Now we need to now from here formulate which model is appropriate for this. What type of study is this? And what model is going to be appropriate depending on the nature of the topic? Is this a qualitative study? Yeah, this seems to be a qualitative study. So which model will be suitable for us to formulate our inclusion and exclusion criteria? Now, I also have another example, comparative effectiveness of different types of exercise for improving cardiovascular health. What type of research question or problem is this? It seems to be a quantitative. Now, what model is appropriate? Now, we also have other ones, patient's preference for telehealth versus in-person healthcare. Now, it's also seems qualitative. Effectiveness of cognitive behavioral therapy for treating insomnia in older adults. It seems very quantitative. Now, your type of research question would determine the nature of model that you want to use. So I want to use this point to thank each and every one of us for giving me a listening ear for this session. So I will be up for questions. Thank you very much.
Hi. Hello.
Yeah, thank you.
Thank you for this lecture. It was very comprehensive and I learned a lot. I have a question. Are there frameworks for mixed method systematic review, or we have to combine?
Okay, that's a very, very good question. Now, depending on the context, like I said, if you are able to combine it, then you must have to do what? Justify it. But a major framework that is usually applicable for a mixed method is usually the PICO framework. So the PICO framework happens to be a very, very suitable model for your mixed method, as well as the spider, depending on the context. And if your supervisor asks you to combine it, that's fine.
Okay. Okay, thank you.
All right, so.
Hello, Mr. David.
Yeah, thank you.
Thank you so much for the presentation. I think it was quite comprehensive and provided so much insight to the systematic review topic. I am doing my PhD in agricultural economics and I'm working on value chains of underutilized crops. But I'm given the task to write a systematic review. I see that a lot of examples that you have given here, it's more in the medical field. So I really do not know where all of these frameworks will fit in for social science study like mine. I have seen the examples you have given on PICO. I think about last week I read on PICO and SPIDER, but I was still not sure where these frameworks will fit in for a social science study. I know that I need to have a clear research question in mind. I have that, but I know that I need a framework. Okay, so for example, now I have been downloading some materials using Scopus, some from Google Scholar, put them on Excel and all of that. But, I'm still overwhelmed with the amount of materials that I have, even though some of them are not really useful. Maybe some that will be useful at the end of the day are not much, but I'm still not sure what framework. I just have a whole lot of materials that I have downloaded. I have so many things I have copied on my Microsoft Word, but I am still confused, so to speak. So I don't know how you can give me an advice.
All right, okay, yes, that's a very good question that I was always going to, attend to, because social science is, it is very, very important. There are also other frameworks that I might have failed to mention, so like the PECO, P-E-C-O, because we have a whole lot of frameworks that we use in formulating, that we use in formulating an inclusion criteria. I don't know if you can hear me. Can you hear me?
Yes, we can, although we can, but I think you have a low tone now. Sorry.
Okay, yeah, no. Okay, all right. So what I was saying is, we have a generalized model, that you can use for formulating whatever. No framework is actually delimited to, a medical field or general, but it's all about how have you been able to identify the participants or the context of what research you want to do, and have you been able to now state undesirable characteristics in those participants or in that particular area where you want to do your search on. And the PCC framework is also another very well advisable framework that you can use in formulating your inclusion criteria, particularly for those in social sciences. PCC usually is for scoping reviews, but for medical sciences, those of them that have very high clinical evidence, we usually use the PICO. You can use the PICO as well, but it depends on the nature of the of the title of the research. But if you feel like you're having any difficulty in formulating the research question, sure, you can always write my email. We can converse. Then maybe I'll also give you much more suggestions and provide appropriate guideline on how you can also formulate your inclusion and exclusion criteria.
Okay, like thank you so much.
Yes, and also an addition to that is that while you're formulating your inclusion and exclusion criteria, you must make sure that it captures all the relevant compartments of whatever research problems that you're working on.
Yes, okay. Please be kind enough to drop your email.
You can always write me via
I will definitely send you an email. I would even call you if that's not a bad idea.
It's all right, no problem. Okay. Any other question?
Hello, David.
Yes, thank you.
Your presentation has been very useful. I just want to understand maybe which
framework. Excuse me, please.
Hello.
Excuse me, please. Thank you.
I can hear you. I can hear you.
Yeah,
we are going to take 3 more questions.
A lot of people are talking. One person needs to talk.
Yes, thank you. We are going to take 3 more questions, and every other question we are going to give feedback through other platforms such as our emails, and you can follow up with Mr. Innocent via email. So the first question our participants are asking on the chat is what is the difference between systematic review and meta-analysis? Thank you. Over to you, Mr. Innocent.
Sorry, please. Somebody else is saying something. Samara, please, can you repeat yourself? I think there's a confusion somewhere. Somebody is. He said, please go ahead. Go ahead.
Okay.
Go ahead. He said, what's the difference between what?
It seems you have already read systematic reviews and meta-analysis. I'm seeing that question, but
okay, all right. Let me answer.
I'm getting feedback that you have already responded to that. Another question is, can the inclusion and exclusion criteria be used for these systematic reviews, be used for any other type of study, or such as primary studies?
Okay.
All right.
All right. Okay. I think I would like to address that question. What we call a system, what we call an inclusion and exclusion criteria, is that for you to conduct any research, for the sake of this class, now we are solely focused on systematic reviews for systematic inclusion and exclusion criteria for systematic reviews. Any primary research can use, a particular framework, but for you to outline an inclusion and exclusion criteria in a primary study, now that is what you do in your methodology, whereby you talk about the type of participants that will be included. Yeah, it can be used, but it can always be used, particularly for randomized controlled trials. Now, but in terms of systematic review, now you're just talking about studies on those people or on those models that you want to use for your synthesis. So maybe you're currently conducting a randomized control trial, or you're trying to test a particular drug, or you're trying to test, let's say you're trying to test a particular drug like metformin. You're trying to test metformin among pregnant women with COVID-19, or you're trying to test remdesivir among pregnant women with COVID-19. In your primary research, which is the randomized control trial, you can state your PICO. You tell us that the participants that will be included will be this. The intervention is going to be this. You're going to conduct several stages of intervention, and the comparator for your primary research is going to be this. Now, in that situation now, whatever thing you're talking about now is based on the primary research you want to carry out, what you are going to do. That is just the concept. But in a systematic review now, talking about PICO, using PICO as a model, now you're not talking about studies that have addressed intervention participants of this, studies that have addressed interventions on this, studies that have addressed comparison as this, and outcomes as this. Now you're looking at, remember, a systematic review is more like a secondary research. You're trying to talk about, you're trying to appraise what has already been done, right? So this is something RCTs now has already been done. So you now use your PICO model now as based on the type of study design now of primary studies that you're looking at now. That will inform your decision making for the model to use. So you use it to do what? To appraise the what? The inclusion and exclusion criteria. So that is that. And also somebody asked a question about what do you call it? About the difference between systematic reviews and meta-analysis. A systematic review tries to look at what? A systematic review is the textual component of what? Of that particular secondary research, because in systematic review now you're trying to use an organized sequence now to answer a particular research question, usually in a narrative aspect, textualizing it. While meta-analysis is more concerned about quantitative evidence, you want to use what? You want to quantitatively summarize, primary articles. You want to use a quantitative evidence to summarize. You see that not all systematic reviews lead to meta-analysis, but for every meta-analysis, there's a systematic review. For every meta-analysis. So not all systematic reviews lead to meta-analysis, because when you're writing a systematic review, you've organized the, an inclusion and exclusion criteria, you've stated a search strategy. Now you now want to qualitize and narratively represent your findings. In that scenario now, you've just done a systematic review and no meta-analysis. A meta-analysis now will be applicable when there is a quantitative phenomena or quantitative outcomes within the study, and you want to do what? Use a numeric approach to provide further results. So a meta-analysis is more like you're using a numeric approach. Now you're using what we call forest plots, funnel plots to represent your results and diagrammatically explain, and also using overall estimates in numbers. So that is how a systematic review differentiates from a meta-analysis. Now, also, I can also see another question. Sorry?
Thank you very much, Mr. Innocent. We have 2 minutes to the end of this presentation. The last question we will take for the day is, what is the full meaning of IC /EC, and how are the systematic review models used to how are these models used to formulate the systematic review process? Thank you.
Okay, IC/EC means inclusion criteria.
Mr. Innocent, did you hear me?
Yeah, I can hear you. I can hear you very clearly. IC/IC, look at this is it. IC means inclusion criteria, EC means exclusion criteria. So anywhere you see on this slide, if I'm going to share this slide, anywhere you see IC/EC, what it means is what? Inclusion criteria or exclusion what? Criteria. Now, you also asked another question. You said, how can these models be used to formulate your research question? From when you look at some of the examples that I've outlined here, like in this part of the process here, in these examples now, models now, you see some of the questions. Now, all the questions in these particular examples were all formulated using the PICO framework. Now, and there's something I needed to have mentioned, although I needed to stick to the ethics of this class, because this class is solely on inclusion criteria and exclusion criteria. The same model you use in formulating your inclusion/exclusion criteria should be the same model for your research question. So the question now is ibuprofen more effective than paracetamol in relieving fever in children? So from this question now, you should visually identify your research questions. Sorry, the model. So meaning what? When you're writing your research question, I've seen some PhD students, when they're writing their research questions, they don't use any model. You just start writing your research question by saying, what is the this, what is the that, how can this, what is the effectiveness of this and that, before writing your systematic, your review question, your systematic review. You must state the model that you use in formulating your research question. And that same model is the same model that you're using to do your inclusion/exclusion criteria. So before you start, you need to say what? You need to tell us that the PICO framework will be used in formulating the research question of this study. Now, from your research question, you identify the participants. From your research question, you identify the intervention. From your research question, you identify the comparison. From your research question, you identify the outcome. Then you now generalize. You have a broad research question. What is the effectiveness of ibuprofen for relieving paracetamol among children? That is another way you can twist this first research question here, and it also forms in line with the examples we just gave out now. So you must not necessarily, you must understand that a lot of students out there, when they are writing that research question, there's no professionalism in writing it, because when you're writing a research question, you must show a model that you've used to formulate your research question. It's very important. And that's the same model you use for your inclusion and exclusion criteria. So you don't get to the situation whereby you have a different model in your inclusion and exclusion criteria and have another different model in your research question. No. If you use the PCC framework to formulate your research question, it will still be the same model to formulate your inclusion and exclusion criteria. Any other question? I think that's...
I have a question, sorry.
All right.
Related on the same, so maybe you explain, but then you should explain. I wanted you to explain further, if that's okay. So how do you then incorporate this into the search? Because I'm assuming that we're doing all this for us to find the search.
Okay, yeah, that's a very good question. I think the class we are here for inclusion and exclusion criteria. So if maybe some other time we have a class on search strategy, then we can now build from the inclusion and exclusion criteria. But let me just give a tip. Now, for you to do your search strategy, you will need to do what? Use your PICO framework to do your formulate your search strategy. You need to find medical subject headings on population, medical subject headings on intervention, medical subject headings on comparison, medical subject headings on outcome. You combine it for a search strategy. But for the purpose of this class, we are here strictly for what? Inclusion and exclusion criteria. So meaning that at the end of this class, it's expected that each and every one of us must have understood how to formulate their inclusion and exclusion criteria. That is the main aim of the class. Then when you've now understood that, then we can now walk you into search strategy on how to develop your search strategy using the medical subject heading thesaurus, controlled vocabulary for your search strategy. Is that okay?
Yes, thank you so much.
All right. So any other question before we call it
Hello, sir.
Okay, all right, go ahead.
Yeah, thank you very much for your incisive presentation. I'm actually developing interest in the whole thing.
Okay.
I appreciate all that you have done. I'm Abraham from Ghana.
Okay, thank you.
Yeah. Deducing from what you have said, does that mean that these acronyms you gave, the P, what were the acronyms you just gave, that actually aided us in, these ones that actually aided in the formulation of the research questions? Is it worth concluding that any other study outside systematic review, like mixed method, qualitative study only, or quantitative, are these also applicable in that context?
That's a very beautiful question. Very beautiful question. Now, in your narrative review, remember, I think we've had a lecture before where we try to differentiate between a systematic review and a narrative review. In a narrative review, when you're writing a normal literature review, your supervisor, your primary research, qualitative research, your supervisor have asked you to write your chapter 2, write your chapter 1, right? Now, in your chapter 2 of literature review, you just pick any heading. Maybe you're writing on diabetes or you're writing on social or in a particular social context. You just generate headings subjectively. You don't say you cite any type of study. You cite systematic review articles. You cite any type of study. When you write a literature review on diabetes and your friend writes your literature review on diabetes, two of you have different references. The reference list is different, right? Because of what? Different approach, different paradigm in writing it. Now, if you want to for you to incorporate an inclusion and exclusion criteria into that your normal literature review, it has now started changing from being a traditional literature review to becoming a systematic literature review. Because in that aspect now, you're now putting considerations for your literature review. So for other qualitative studies, like you asked in your question, quantitative studies and primary research, you can also have an inclusion and exclusion criteria, but it now depends on the particular model that you want to do using writing it up. So you can have a normal undergraduate or master's or PhD project that you're working on, and that's not a systematic review. And in your methodology, you have an inclusion and exclusion criteria of some certain practicals that you will do and the ones that you will not do. That's also inclusion and exclusion criteria, but on its own. But for this lecture, we are looking at inclusion and exclusion criteria and models for a systematic review. You can write any type of research or even a commentary, and you say, this is your inclusion and exclusion criteria. You're going to include this, you're going to include that, exclude that. Now, you might not necessarily have any model for adopting this your inclusion and exclusion criteria. You might just decide to generate the teams based on this you're excluding, based on experience of this you're excluding, based on that you're excluding. But for a systematic review, dissertation, publication, whatever, for you to do your inclusion and exclusion criteria, these models that I've listed out must be followed. Either of them must be followed. There are many more models, if you look at the Cochrane handbook of systematic reviews of interventions and all that, the Cochrane handbook, you see other models that are still formulated in line with the type of studies. So for the nature of this class, we needed to have known the inclusion and exclusion criteria for only a systematic review. If you want to apply it in a qualitative research, then it's up to you and your supervisor, it's up to you and your own intuition of what you're interested in. But for the nature of a systematic review, these are the only models. These are the models that you must use in presenting your evidence. Thank you.
Thank you very much, Mr. Innocent. Thank you so much. Thank you for sharing this webinar. Thank you, dear participants, for coming. We will be sharing our, at the end of, please, can you mute yourself, please? Please, thank you. Thank you. Thank you. Thank you once again, Mr. Innocent. Thank you, dear participants, for coming. we are going to share with us the record of this webinar, and we will keep you posted on our next event. Thank you. Bye-bye.
Thank you very much, and bye-bye.